Good afternoon, everyone. My name's Dale Armstrong from Staying Alive Australia. My background is I'm an intensive care paramedic, and also for the last 10 years. And before that, I was a nurse for 10 years or so, and mostly in critical care areas. Staying Alive's become very involved in defibrillators and the teaching of CPR, and the reason we've done that is because we've been involved very closely with a number of clubs and organisations within the community that have suffered the death of young athletes at their club. And as you can imagine, that's actually very devastating for everyone involved. As paramedics, we thought that we showed empathy and worked well with the club, but we then left and never saw the two meet again. As when we started this business and we're actually involved over a longer period of time, or had a longer relationship, that we really saw just how devastating it is. We thought we understood, but it is clear to us now that we didn't. So we've become passionate about educating the community about the importance of early CPR and defibrillators. And what I want to present today is some of the myths regarding defibrillators that are out in the community, some of the things that people are saying against clubs and organisations purchasing defibrillators is just mind-boggling, and I want to bust some of those myths today. So defibrillators have come a long way since the early days. Defibrillators, I'd say probably back in the 70s or even 60s, were big devices. You can see here, this is one of the first early defibrillators. It's actually quite a large box, and this is a defibrillator by the Schiller company that is actually monitored 24/7 by the internet. So you can see they've come an awfully long way. Back when this was developed, there was probably, or certainly, no internet at all. In the early days of defibrillators on ambulance, they were actually powered by the engine of the ambulance. So if the paramedics went to a case where the person was in cardiac arrest and they needed defibrillation, they had to carry the patient out to the ambulance, place them in the ambulance before they could be defibrillated. Back then, only micro ambulances or intensive care ambulances and hospitals had defibrillators. In the late 80s and early 90s, defibrillators expanded out to all ambulances. Certainly within New South Wales and Victoria that was happening. And there was a famous case involving Kerry Packer where he suffered a cardiac arrest during a polo match, and he was very lucky in that one of the only ambulances in New South Wales to have a defibrillator on board at the time attended him, defibrillated him and saved him. And as a result, he financed defibrillators for all the ambulances in New South Wales. So what we're talking about is sudden cardiac arrest. And sudden cardiac arrest occurs without warning, basically. Your heart stops beating effectively, and so therefore you are at risk of death. And death will occur within a few minutes if you do not have early CPR and early defibrillation. Within Australia, it occurs approximately 33,000 times annually. So 33,000 Australians annually suffer from sudden cardiac arrest. And importantly, the very important points are it can affect anyone of any age, of any fitness at any time. And we're seeing a lot of athletes during exercise and sport suffering from sudden cardiac arrest, including elite athletes, people who are supremely fit and young and in the prime of their life have sudden cardiac arrest. So again, it affects anyone of any age, any fitness, any time. And whilst heart attack is clearly the most common cause of sudden cardiac arrest, it's not the only cause, and it's not usually the cause that affects the young. It usually affects the middle to older age groups. There are many other reasons. And Aaron's just asking, isn't sudden cardiac arrest the same as heart attack? No, they are different. In sudden cardiac arrest, your heart has stopped beating effectively, so basically unless you get that intervention of CPR and defibrillation within the next few minutes, say 4 to 5 minutes, then you will suffer irreversible brain damage. In heart attack, there is a blockage in the artery that supplies blood to the heart muscle, and so part of that heart muscle becomes affected and may actually die, but your heart continues to beat. Now you can imagine if part of your heart has started to die, then you are at risk that your whole heart would stop working, and therefore you suffer cardiac arrest. So heart attack is where just a small part or part of your heart is affected by blood supply. Sudden cardiac arrest is where your heart has stopped beating and your whole body is going to die. Now there are a number of causes of sudden cardiac arrest that are often not talked about. So we've said heart attack is one of the most common causes. The other common cause in athletes is hypertrophic cardiomyopathy, and that's basically a hereditary disorder where it leads to enlargement and thickening of the heart, especially in the left ventricle. But the actual chamber where the blood fills doesn't enlarge, it actually gets smaller, so it can't fill up with blood as effectively. Other reasons are myocarditis, which is usually an infective process, and often people will show signs of viral illness like cold or flu, but sometimes sudden cardiac arrest may be the first sign. And it's staying alive. We've seen a couple of cases of young athletes dying from sudden cardiac arrest, and at autopsy they've had myocarditis. There's other congenital problems that involve the electrical system of the heart, such as long QT, and which is an electrical problem, Wolff-Parkinson-White, which is an electrical problem, or abnormal anatomy, where you can have such things as the coronary arteries, the arteries that feed the heart blood, are in abnormal positions. The other very rare but does occur and requires a mention is a disorder called commotio cordis, which means concussion of the heart. And what happens is the athlete gets hit in the chest by a cricket ball, a hockey puck, or something like that. We saw a recent case in Greensborough in Melbourne, probably 1 or 2 years ago now, where a cricketer was hit directly in the chest with a cricket ball, and it caused the heart to go into an abnormal rhythm, and he suffered cardiac arrest. Very lucky, he survived. He had immediate CPR, and he survived that incident. It's relatively rare because it's believed that not only do you have to be hit in the chest with significant force, but it has to be right at the right cycle of the cardiac cycle. So there's a cycle of electricity in the heart, there's a rhythm, and it has to hit at exactly the right rhythm, and we're talking about within a millisecond. So it is reasonably rare. Sudden cardiac arrest, as we've said, affects anyone, any age, any fitness at any time. Here we have Alexander Dale Owen, I believe it is, who was a swimmer, an Olympic swimmer. He was training for the London Olympics, 27 years of age. He was found dead after training in the change rooms, and it's believed he had a massive heart attack. Fabrizio Muamba was a FA Cup match in England. It was during a final at 23 years of age. In the middle of the match, in front of a packed stadium, just collapsed in the middle of the field and suffered sudden cardiac arrest. Very lucky, he had immediate CPR and defibrillation, and but he required extensive resuscitation, but he survived, more importantly. Just to illustrate, any age, any fitness, another couple of young athletes, very fit, very healthy otherwise, suffered sudden cardiac arrest. Any age, sadly, toddler, suffered sudden cardiac arrest in bed, didn't get up in the morning, had been seen by mum, I believe, earlier in the morning, told it's time to get up. Yes, mum, I'll get up. Didn't come out. Mum went back in, and he had suffered a cardiac arrest and sadly passed away. This is a home and away star, Dennis Code, who had a sudden cardiac arrest while playing soccer at a local soccer club, who did have a defibrillator, and he was actually defibrillated once, so electric shock was passed to the heart once, and and by the time the paramedics arrived, here's a photo of the paramedics, and Dennis, by the time the paramedics arrived, he not only had a heartbeat again, but was actually starting to respond and regain consciousness. So that's, quite an amazing outcome. And even more amazing is the fact that the same defibrillator that saved Dennis Code has now saved a second person in less than 12 months later. And that person was in their 40s, again, playing soccer, and again, just suddenly collapsed in cardiac arrest. And again, the defibrillator gave them a shock, and they had a heartbeat, I believe, by the time the ambulance arrived. So what's myth number one? Well, there's no need, we often hear there's no need for a defibrillator, you can wait for the paramedics. We've had a number of community groups say that they're not going to worry about a defibrillator because the ambulance station is right next door, or it's a couple of kilometres down the road, and surely the response time won't be that long. Well, it will be that long, it can be that long, and what if that ambulance isn't there? So, and the other thing is, there's only two things that have ever been proven in medicine to work in cardiac arrest. And that's two things that the community can do. That's early CPR and early defibrillation. Defibrillation is the only definitive treatment for sudden cardiac arrest. And we know this, we have this chain of survival. And we call it a chain because it's made up of several links, 4 links, and it's only as strong as the weakest link. So therefore we refer to it as a chain of survival. The first part is early recognition and call for help. So at cardiac arrest, or the high risk of cardiac arrest, such as heart attack, then it needs to be recognised early and ambulance called early. The sooner they're called, the sooner they're on their way. And people don't recognise cardiac arrest and do nothing, then minutes are ticking by, and within, say, 5 minutes, there's irreversible damage to the brain starting to occur. So CPR needs to be done, needs to be recognised very early. Early CPR to buy time. Early CPR to keep pumping blood around the body so that the defibrillator can work, and to maintain blood supply to the brain and the heart. It only buys you a little bit of time. It doesn't actually definitively treat sudden cardiac arrest. It just buys time. But it is a very, very important part of the chain of survival. If CPR is not performed, then once again, irreversible brain damage will occur within a few minutes. Early CPR is part of the chain of survival. This is what we're talking about today. It is a crucial part of the chain of survival. We know that for every minute there is a delay to being defibrillated. If you collapse in sudden cardiac arrest, there is a 7 to 10% reduction in your chance of survival. Finally, post-resuscitation care or early advanced life support, that's what the paramedics do and what the hospital does, basically once you've been resuscitated. The important point is these parts here, the first 3 links in the chain of survival, are what you as community members do. This is what the bystanders, community members do, and it is the most important part. You could have the world-leading physician turn up, the world-leading doctor in resuscitation in sudden cardiac arrest, turn up to your sudden cardiac arrest. If these things have not occurred, there is nothing that person can do for you. It is too late. So this is very, very important. So we know through several studies that if you get defibrillated in the first minute that you collapse from sudden cardiac arrest, you have a 90% chance of survival. And for every minute that goes by before you're defibrillated, your chance of survival is reduced by 7 to 10%. So by the time you get down to 5 minutes, your chance of survival is now dropped from 90% down to 50%. Give it another couple of minutes, down to 7 minutes, your chance of survival, you are more likely to die than you are to survive. So the people that say, it's okay, there's an ambulance station nearby, well, at best, it may take 5 minutes for an ambulance to arrive from the moment you collapse. So somebody has to recognise it, call the ambulance, they have to get the details, dispatch the ambulance, the paramedics have to get to the ambulance, look up where they're going if they need to, get there, get their equipment out of the ambulance, get over to the patient. So clearly you are talking realistically 5 minutes minimum, if the ambulance station is 2 doors away, for you to receive defibrillation and sudden cardiac arrest. By the time you get down to 10 minutes, it's less than 5% the chance of survival. And less than 5% is the average chance of survival in the pre-hospital or community setting for sudden cardiac arrest. So why does this happen? Why is it so important? Well, studies have found now, when you first have a sudden cardiac arrest, you are often in a rhythm called ventricular fibrillation. Now what's important about that? That is the chaotic wavy line we see here. That is called ventricular fibrillation, and your heart is like a bag of worms. It's not pumping, it's just quivering. And it needs an electric shock to get it started again. And what electric shock actually does, it stops all this electrical activity and lets the heart's normal electrical rhythm take over. So we know when you first have cardiac arrest that this is very coarse. You can see it's very high up and down. And what we've discovered is that makes it very receptive to defibrillation. And the finer it gets, or the less it gets, so this is very fine down here, the less receptive it is to defibrillation. It won't, the defibrillator is less likely to work the finer it gets. So it's really important that people receive defibrillation in the first few minutes here. After about 10 minutes, it's flatline. And what you see on the movie is the flat line. And even though on the movies and on TV they defibrillate these patients, but that's just because it's nice and dramatic, these patients don't receive defibrillation. So if the paramedics come along, you will often see them not defibrillate, well, you should see them never defibrillate a flat line like this. And in fact, the automatic defibrillators that are in the community will not defibrillate that either. It just doesn't work. It's not going to do anything. So as you can see here, virtually 0% chance of success. When sudden cardiac arrest occurs, we follow an algorithm, if you like, doctors A, B, C, D, and it's very important that everyone remembers this. And that's so that we always have a systematic approach, we can remain calm, and nothing is missed. First thing we want to do is check for dangers. Why has the person collapsed in cardiac arrest? So if it's a work site such as a building site, industrial site, one of the most obvious things to consider is electricity. If it's on the football field, it's unlikely to be major dangers. You do have to still consider slip, trip hazards, has play stopped, all that sort of thing. So think about your own safety. Response. Is a person responding? So a gentle shake and shout. Open your eyes, can you hear me? Send for help. This is where you send for help. This is where you call an ambulance, have somebody call an ambulance, 000, and have somebody get the defibrillator. So let's assume you're at your football club. This is where somebody on the sidelines needs to go and get the defibrillator. And one thing we have been really pushing is the Hendo sign, and that can be seen at thehendosign.com.au. You send for help, and there's a signal for the football field to alert people that we need the defibrillator. Now that doesn't mean you're necessarily going to use a defibrillator, it just means that you're going to have it there a lot quicker than if you wait for down here. As we've already discovered, every second counts for the time to defibrillation. The next thing you want to do is check the airway. Make sure it's not obstructed. On the football field, remove mouth guards. People with dentures, if they're sitting sideways or clearly not sitting properly, take them out, otherwise just leave them. Most people's dentures will just remain in place. Tilt the head back, and then look, listen and feel for breathing. So look for the chest to rise and fall, look for the stomach to rise and fall, put your hands on the upper abdomen, feel for it to rise and fall, and listen. This should take no longer than 10 seconds. And what you're looking for is, are they breathing normally or not breathing normally? So not are they breathing or not, but are they breathing normally? When people first collapse in sudden cardiac arrest, they often have gasping breathing. And it's a bit like a fish out of water. It's clearly not normal. You will think it's not normal. If you're unsure if somebody's breathing normally or not, assume they're not. Assume the worst and start compressions. In the mid to lower half of the sternum, the breastbone, you want to press hard and fast. You want to press about a third of the chest diameter. So think about that. That's actually quite deep. And the chest will spring back up for you to press again. About 100 times a minute you want, to the beat of staying alive. So hard and fast. And then finally, defibrillation. So if you've got to this point, then you need to be getting to this point. Attach the defibrillator. The important point here is, do not have somebody collapse, not respond, send for help, and then put the defib on to tell you what to do. Because all the defibrillator tells you is if that person needs an electric shock or doesn't need an electric shock. It doesn't tell you if they've got a heartbeat or not. It can only tell you if the heart needs an electric shock or not. So it only looks at the electrical rhythm of the heart. And it's possible for somebody to have a normal electrical rhythm of the heart and not have a heartbeat and need CPR. So the machine can be fooled. And if you think about it as a car in neutral, you can rev it all you like, you see the power, the normal electrical response. The wheels aren't going to turn though, because it's in neutral. Same sort of thing, you can have a normal rhythm and be in cardiac arrest. Similarly, you can be in a rhythm that's not normal but doesn't require defibrillation and be in cardiac arrest. So it's very important to follow this dangerous response, send for help, airway, breathing, not breathing normally or not breathing at all, start compressions and apply the defibrillator, and then follow what the defibrillator is saying to you. So what's the evidence for defibrillators? Well, there's a lot of anecdotal evidence in monitored patients, and they've found that if you have a patient who's being on a heart monitor, has a sudden cardiac arrest and receives defibrillation almost instantly, most of the time they wake up and say, what happened? And that sort of episode really led to a big study involving St John's and the MCG and Shrine of Remembrance. And a person by the name of Dr. Jeffrey Wasserthiel did a big study to say, well, why is it that patients in ambulances who we know are having a heart attack are on a heart monitor, suddenly have a cardiac arrest, they get defibrillated straight away by the paramedics, or they're in coronary care or in hospital being continually monitored, and they have a sudden cardiac arrest, get defibrillated straight away, they seem to all survive, almost always survive, and almost always straight away. But why is it in the community, even though we're defibrillating patients, less than 5% of people are surviving? It doesn't make sense. So what they did is they teamed up paramedics with St John volunteers at the MCG and Shrine of Remembrance, where there were a lot of cardiac arrests occurring, and they found that they were able to get the survival from sudden cardiac arrest by having defibrillators in the community from less than 5% to up over 85%. That is an enormous, enormous turnaround, enormous improvement, almost unheard of in medicine. That study was pretty much replicated at Chicago O'Hare Airport, very, very large airport, lots of defibrillators throughout the area, and again they were able to get the survival rate from less than 5%. I believe it was over 75%, I believe. Tullamarine Airport, anecdotally, many patients, you can imagine tens of thousands of people go through Tullamarine Airport every day. There are defibrillators throughout the airport, and it is very, very common for people to receive a bystander-initiated defibrillation. So somebody, just a person walking along, sees somebody collapse in sudden cardiac arrest, they take the defibrillator off the wall, defibrillate them, and the person survives. And this is a photo of a media photo of Micah paramedics and airport firemen who defibrillated this lady, and they're talking about the importance of defibrillators in the community. Casinos as well. Many casinos in the US have replicated the study again, and we've seen casinos in Australia all have defibrillators, and again there's a good outcome for sudden cardiac arrest in those areas. Now Olivia's asking where are the defibrillators in the airports, because she's never seen it at Tullamarine Airport. Basically in airports or shopping centres or wherever, if you look for signs similar to this one here, that's where the defibrillators will be. It does take a little bit of a look. Generally speaking, they will be in areas where there's other emergency equipment such as fire extinguishers or fire hoses, but they're usually in highly populated areas, so where crowds are. So in shopping centres, the food courts are a common place, up high on a pole, and it's good exercise if you just go in, if you think about it, just go, I wonder where the defibrillator is, and have a look. But they're usually there. There's usually signs. They're usually well signed like this to show you where they are. So myth number 2, you need specialised training to use a defibrillator. Well, that used to be the case. You used to have to be a MICA paramedic or intensive care paramedic or a doctor to use a defibrillator, but that's now not the case. Following Jeff Wasserthiel's groundbreaking work on early defibrillation in the community, the challenge was put out to defibrillator manufacturers to develop an automated defibrillator that anyone within the community can use. And now we have defibrillators that are simple to use and designed so that anyone can use them regardless of training. Even a child, say of 13, 14, should be able to use a defibrillator without any training. And we have actually done this type of presentation to community groups, and we've said, has anyone here had no CPR training, never used a defibrillator before? We pull somebody out of the crowd, we say, right, go for it. And all they do is we turn the defibrillator on, do what the defibrillator tells them, and away they're up and away. They're doing it without any problems at all. So defibrillators are simple to use, and they're designed for anyone to use at any time. So if you are in a shopping centre, in the airport, a train station, or wherever, and you see the need to use one, do not be afraid to go and grab it off the wall and just use it. Just turn it on and do what it will tell you exactly what to do from then on. And you just do it. We do know, though, that if people do not receive some sort of familiarisation training in the use of defibrillator, it doesn't have to be anything formal or nationally accredited or anything like that. Unless they receive some familiarisation training in the use of defibrillator, they will not have the confidence to take it off the wall. So that's a really important point. But they are designed so anyone can use them. So what are the recommendations around defibrillators? Well, they need to be highly visible and accessible. So we've already had Olivia ask. She's never seen them in the airport, so they're probably not visible enough then, if that's the case. So they need to be highly visible and accessible. This is a Japanese train station. You can see this is very visible. Everybody walks past this every day, so they know that that's where the defibrillator is. And that's ideal. Somewhere that is, they see it every day, all the time. So when they say, oh yeah, I know where that defibrillator is, straight away. There's no delays in getting it. I've already mentioned a little bit about training. People really do need to have some sort of familiarisation training. As I said, they will tend not to grab it off the wall if they've had no training. They will be too scared of it. It's something that doctors do in hospitals. It's not something that I should be doing as a bystander. That's not correct. Do not be afraid. Grab the defibrillator and use it. They need to be monitored and maintained. Absolutely. At least monthly, somebody needs to check the defibrillator. Make sure that the electrodes that go on the chest are in date. They have an electroconductive gel that's sticky, that sticks it to the chest, and that will eventually dry out and crack depending on the manufacturer. Lifetimes vary, but that needs to be made sure that they're in date so that you never have a situation where you have dried, expired pads that you can't really use on somebody because they're all dried up. That's not going to save a life. The other issue that we've seen coming out of the States and Canada in recent years, who seem to be for some reason far ahead of Australia, is they've had defibrillators in community settings but no one looking after them. So they've been there for years. and there's been media report after media report of those defibrillators being deployed and having a flat battery and completely unusable. They don't tend to work well with a flat battery. Most of the defibrillators have a way to tell you that their battery's getting low before it goes completely flat, and that should be changed at that point. Should be coordinated with emergency services. So let your local ambulance know that you've got a defibrillator and where it is. In Victoria, Ambulance Victoria has a good system of register your defib. Basically, they keep a register of where all the defibrillators are in Victoria, and when they dispatch an ambulance to that location, it will come up for the paramedics that there is a defibrillator at these locations, and they will tell the caller, if it's appropriate, to go and get the defibrillator from X position, and this is how you use it. So even ambulance services are saying go and get your defibrillator and use it. Also, a core group of people as first responders. And this is what's happening at the airport, casinos, places like that. They have people that are responsible to respond. So even though the community can use it, these people will come along and take over because they've been specifically trained in the resuscitation, and not just in the use of defibrillator, but in resuscitation in general. So that's the other recommendation. So who should have them? Well, venues of high risk, and there's been a few studies to say, well, where do defibrillators need to be? Sports clubs, we've spoken about football clubs. This young chap was very, very lucky. He had a sudden cardiac arrest and survived. I don't think there was a defibrillator there, so he was very lucky. He defied the odds, but he did get very good CPR straight away, and ambulance turned up within a very quick time frame to provide defibrillation. So sports clubs, because we know the young who have congenital abnormalities or a myocarditis or something wrong with their heart that hasn't been previously picked up, it's when the heart is under duress, such as sport, that sudden cardiac arrest occurs. Transport hubs, airports, railway stations, because tens of thousands of people are going through there with all sorts of medical conditions, all sorts of heart conditions every day. So the exposure to those people over time is very, very high. We spoke about airports. It's not uncommon to see sudden cardiac arrest at airports, especially airports the size of Tullamarine and larger. Large gatherings, stadiums. I spoke about the MCG and Shrine of Remembrance. Again, tens of thousands of people spending time at these locations with all sorts of medical conditions, heart conditions, etc. They're at risk of sudden cardiac arrest. Golf courses tend to be a high-risk place. Study after study have shown there are many cardiac arrests on golf courses. Why? Not really sure. But golf courses certainly, and there are a number of golf courses that now have defibrillators strategically placed around the golf course. Gymnasiums, again for the same reason as sports clubs, also because you do have very unfit people there who are working their body very hard and putting their heart under duress. So it is an area where we do see sudden cardiac arrest occurring. Jails, large number of people, lots of comorbidities, delayed access to ambulance. They have to get through all the security. They can't just drive straight into a jail. So regardless of how severe the issue is, there will always be, by the mere nature of a jail, delays to ambulance. Large industrial sites, again, you have a large number of people doing physical exertion with lots of different medical conditions, different levels of fitness, so your risks do go up. And there again is a delay to ambulance access to those areas, and anywhere where ambulance access is delayed. So unless you can guarantee ambulance will be there and able to defibrillate you within 5 minutes, it's suggested that you should really consider having a defibrillator on site. Okay, so Wesley asks, should schools have them? We argue yes, schools should have them. And the reason we argue schools should have them is this. Sports clubs, it is widely accepted, even within Australia, that sports clubs such as football clubs, soccer clubs, rugby clubs should have defibrillators. We've seen a number of instances where young players have died, and I've shown you a couple of instances where players have survived with the presence of a defibrillator. Now, the reason sports clubs is because the people playing sport, even though they're fit and healthy otherwise, or seem fit and healthy, they may have underlying conditions that when they put their heart under exertion, such as playing sport, they're at risk of sudden cardiac arrest. Well, consider the average sports club, or the average footballer, if you like, goes to training once or twice a week for a couple of hours and then plays a game for a couple of hours. So exposure of about 4 hours per week. Now that same person may spend time in school. Let's say the average school day is 6.5 hours times 4 is 24, 36 hours a week at school, and they do play sport, they do run around, they do put themselves under exertion at school. So really the risk, if you consider the amount of time they spend at school, is higher for schools than it is for sports clubs. And so at Staying Alive, we believe that schools should all have defibrillators for that reason. And not only that, as paramedics, we have been to a number of schools for teaching staff, and also working bees is another common time where we have been to sudden cardiac arrest in a school is for the working bee on the weekend for the parents. So it's not just for the children, but for the staff and the parents as well. Myth number 3, owning a defibrillator increases the liability risk of litigation. This is a very common myth that people come up with as to why they don't have a defibrillator. They are scared that if they have a defibrillator on their premises, that they will have higher risk of being sued for some reason. If you consider, it's a bit like saying, I don't want a first aid kit on site, because if I have a first aid kit on site, I will have the risk of being sued because I've got a first aid kit. It's exactly the same. In fact, if you look at cases in the USA, not having a defibrillator on site may actually increase your risk of litigation more than having one. So there's a few legal issues that we need to discuss. Within Australia, there are Good Samaritan laws that protect you. Using the defibrillator is part of first aid. It is part of every first aid course now. And therefore you are protected by Good Samaritan laws throughout Australia. So if you are doing the right thing for the right reason and you cause harm inadvertently, you cannot be sued, you cannot be litigated against. There is no known litigation in Australia relating to the use of defibrillators at all. There are several in the US relating to not having a defibrillator. There's an airline who sued and settled out of court for hundreds of thousands of dollars when a passenger sued because they did not have a defibrillator on board, and their husband suffered sudden cardiac arrest during a flight. There is a theme park, a large theme park, was sued when a 6-year-old child suffered sudden cardiac arrest and there was no defibrillator at the theme park. And there was a large chain of gymnasiums sued and settled out of court. So they all settled, they all had to pay hundreds of thousands of dollars when a client had sudden cardiac arrest and died because there was no defibrillator on site. We know in a recent case in Victoria of a gymnasium who did have a defibrillator on site, who did have first aid training, but it was one of the things that the coroner looked at when they investigated the death of a client at a gymnasium. It was something that was looked at, was a defibrillator on site, and thankfully for those people, yes, there was. There is also a national code of practice for first aid in the workplace under the workplace health and safety laws, and that states that you need to consider should you have a defibrillator on site or not. So there are basically the legal issues are you are more likely to be sued, we believe, if you don't have one than if you do have one. Of course, you do need to maintain and monitor the defibrillator. If you're going to purchase a defibrillator, we like to provide lots of support and help for people because it is something that you don't go out and buy every day. It's not something you go to the supermarket and buy off the shelf. So one of the things you really want to consider is the ease of use. So we've said people need to be able to have never seen a defibrillator before. and be able to use it straight away, not have to sit there and try and work it out. You see this defibrillator here has an obvious on-off button, the usual international on-off button there. Once you turn that on, it will tell you exactly what to do. The Schiller machine has an obvious on-off button, again, will tell you what to do. So consider the ease of use. Is it easy to use, or do you need a little bit of training? What's the reliability? Sadly, defibrillators, some defibrillators and manufactured defibrillators have recall after recall after recall. This is not an item that you want to have to be recalled because it's unreliable, or something is wrong with the device. It's also frustrating that you then have to go and do something about the recall to ensure that your defibrillator is reliable and usable. So reliability is a big issue, and we always say Google, if you're looking at buying a machine, Google the manufacturer's name and then put recalls and then see what comes up. Also consider your cost of, after sales support. So there has been some companies who have had recalls and their after sales support has been excellent for customers. Occasionally recalls will happen, but we just want to be careful as to what's happening there. They're not continually unreliable. And then what happens if there is a recall? How upfront are they? How supportive are they? How helpful are they? Also, if you want consumables, how helpful are they? Consider the cost of your consumables and any extras. Alright, so you could get a really cheap defibrillator, a bit like a printer, but have really expensive batteries and electrodes. They're your consumables, batteries and electrodes. So you want to look at how long will they last and how much do they cost, and really weigh up what those ongoing costs are going to be. And consider the whole package. If you're buying a defibrillator, you really need signage, cabinetry or cases, your batteries and electrodes. Is there a replacement program? All those sorts of things. So consider what the whole package is, consider the warranty time, and how much support you're going to get. Very important. So Marcus is asking, what's the average cost of a defibrillator? Well, you can get very cheap defibrillators in the sort of $1,500 range. We caution you looking at those defibrillators because they are often cheap and nasty. They're cheap for a reason, and their reliability is questionable. There's always new ones coming on the market, but certainly in the past we found that cheap is not necessarily better. At the same time, you can get defibrillators that cost upwards of $5,000. Again, expensive is not necessarily better. You have to question whether you need all the things on that defibrillator. Defibrillators all do one thing. They all check the electrical rhythm of the heart and decide if electric shock is required or not required, and if it's required, deliver the electric shock. How they do that differs from defibrillator to defibrillator, and then they have all sorts of add-ons. So this defibrillator here gives CPR feedback. So it will actually measure how effective your CPR is and tell you to go deeper or faster, and give that feedback, which a lot of people like. But again, you're going to pay a little bit extra for that. Similarly, you can get this type of defibrillator without that, and that's around the $2,200 mark. With the CPR feedback, you're up around the $2,800 mark. So you can see there's added extras, and if you have other added extras, then again, they'll cost more. So the one that did the continual monitoring by the internet, again, do you require that? If you do, if it's something that you want, then you are talking about $5,000. So it's really what you need, but really you could get a stock standard defibrillator, entry level, nice and reliable, around the $2,000 mark as a ballpark figure for defibrillators. Finally, to finish off, this is Dennis Code, the home and away star who suffered sudden cardiac arrest playing soccer and was defibrillated by the local club defibrillator. And you see here, mobile intensive care ambulance paramedic has said that there's no doubt the defibrillator helped save his life. And an important point that we made, because we were involved in the purchase of this defibrillator, is not only did the people that day actually rescue and save Dennis from his sudden cardiac arrest, but the people in the community who had the foresight to get funding and get that defibrillator into the club probably about 12 months earlier were pivotal in the saving of that life and now a second life. And it should be noted, and credit given to Bendigo Bank Bendigo Bank Eltham, who helped support a number of clubs in the purchasing of defibrillators and was involved in the purchase of this defibrillator. And I'm sure they're very proud at the fact that that money that they donated to the community has actually now saved 2 lives. So very, very important point. And I'll take any questions. Okay, so Marcus has asked, don't you need training for new equipment in the workplace, and shouldn't people receive training? Yes, that's true. The point there, you're talking about a workplace versus a community setting. Yes, if you bring equipment into the workplace, the national safety laws do require that there's adequate training of the staff in that equipment. Now that's up to you to conduct a risk assessment and the level of training, but I would suggest, and we do at many workplaces, a familiarisation session so everyone's comfortable and confident with the use of the defibrillator. It would be sufficient on the majority of cases. Certainly if they're going to be designated response people, then you would get them to do a CPR course that involves defibrillation, which they all do these days now. In the community though, you don't have to train everyone in the community, and they are developed so anyone can use them. So, yep. Okay, so Olivia's asked, where does the chain of survival come from? Who developed it? To be completely honest with you, I don't know exactly who developed it, but it's something that's been adopted globally. There's a organisation called the International Liaison Committee on Resuscitation, and that is made up by resuscitation organisations out throughout the world. So in Australia we have the Australian Resuscitation Council. In Europe they have the European Resuscitation Council. I believe in America it's the American Heart Foundation or American Heart Association. So all these organisations from all over the world gather every 5 years and look at all the evidence relating to resuscitation, from first aid in community to what they do in intensive care. And they have adopted the chain of survival, and they recommend the chain of survival. So it's something that's come from a very well documented, renowned, respected body, basically. So no more questions. So thank you very much for your time today, and I hope that you enjoyed it and it was useful to you. Thank you.